Most of us have occasional nights when we can't sleep, but a lot of people have serious chronic sleep disorders where they're chronically not sleeping. And this leads to things like high blood pressure. It can lead to heart disease. It can also lead to stroke. It also impairs your relationships with others. When you're sleep deprived, you go straight from your stage 1 into REM sleep, and you don't get into stage 2 sleep, which is where your body releases the hormones that actually make you feel refreshed in the morning. Most people associate sleep disorders with, around 55 to 65, but the American public is obese, and as obesity, if you have a very thick neck and you have a lot of adipose tissue on your trachea and you fall asleep at night, that pressure on the trachea will actually obstruct your airway. It's usually their bedroom partner that refers them to the sleep lab. Maybe this person snores at night, and a lot of patients have what is called apnea. Apnea is Greek for lack of breath. Obstructive sleep apnea is the most common form. A lot of times a patient has gained weight. As we get older, our muscle tissue is not as firm, so it doesn't support us as well as it did when we were younger. Or maybe we just have a crowded airway, and all of these things can obstruct the airflow. Central apnea, some people's brain just tells them not to breathe at night. It's so important to have your sleep study at the altitude that you live at. Here in Park City, our altitude is much higher than it is in Salt Lake City. So if we have a sleep problem and we live in Park City, we should be studied in Park City. We're going to be looking for things like restless leg syndrome. We're going to look for things like patients sometimes grind their teeth at night, and that wakes them up. We're going to monitor their heart rate and their respiratory rate continuously the whole night while they sleep. We're going to monitor their oxygen saturation. We're also going to hook up EEG and EMG electrodes. These measure brain activity, and they also measure muscle activity during your sleep. It's a lot of data. It takes us approximately 45-50 minutes after the patient goes home just to download all this data. By monitoring the patient during the night, we're able to make a good diagnosis, and then the physician can put the patient on medication. Maybe they have some behavior modifications like abstain from alcohol, abstain from coffee, or maybe it's something the patient must wear a oxygen or continuous positive airway pressure, which is a Cpap machine. It is a much more comfortable procedure than patients were used to in the past. A mask, it can be just a nasal mask that just barely covers the nose. It can be nasal pillows, which is along this line. And the pressure is actually, we regulate the pressure while the patient is here for a sleep study, and we call it a Cpap Titration. When you're sleep deprived, it feels so good, and it's humidified, and patients just love it once they get used to it. It usually takes about 4 to 6 weeks, and like Stacy says, she can't do without hers. A lot of patients will actually lose weight after they go on their Cpap. They feel better, they're refreshed. The Park City Medical Center is actually a satellite of the LDS hospital, the Intermountain Hospital in Salt Lake City. Our lab is accredited by the American Association of Sleep Disorders, so that's the highest a sleep lab can be rated in the United States. If you have any further questions, I'd suggest that you probably contact your primary care physician, but you can also contact me here at Park City Medical Center in the sleep lab. I'll be happy to answer any questions. I'm at area code 435-658-6718.